Hi, I'm Carol Nickasch from Milwaukee Area Technical College, Dental Hygiene faculty, and today we're going to have a video on how to assemble holders.
All right, when we're doing bite wings, there are many different techniques and holders. So one of them would be just the loop, which is straight, and then you just push it, make it into a T, and then place it on your film. The most important thing here is to remember we're going to take maxillary and mandibular arch. So your tab, whatever you're using, has to be centered in the middle of your film. Where it is front to back doesn't make any difference because you're just using it to hold. But the important part is that half of the film is on the top and half of the film is underneath the tab. We could use a tab, we could use the sticky sponge, as long as that when you place it on there, it is centered on the film. Then we can go into the different holders for the RIN. So we have a RIN holder, which is used for the anterior. It's a straight holder and a straight stem. We have the horizontal bite block, and we put our film in the same way. And then where we center it left to right doesn't make any difference as long as the film is centered in the holder, which it would be. If we're using the vertical holder, obviously the film would be in vertically for the posterior, and then we would have the number 1 film for the anterior view. Again, depending on where you are and how you're going to place it in the mouth, your film has to still be centered within the holder. So just for an example, we'll put this together for the posterior. We use the straight stem. We take the ring and slide it on there so that the flat part is towards the face, and then use the holder that we want to use. So this is the way it would look when we're setting it up. Okay, now the next technique we're going to be doing is paralleling technique, and we're using the RIN system again. So we have 2 different holders. One is very flat, one has a couple of bends to it. The one with the bends is the anterior, the one that's flat is the posterior. Then you have an offset ring and a ring that is centered. So the one that is centered goes to the anterior, the one that is offset goes to the posterior. And then our holders are the same. We're going to be placing our films in the posterior of the mouth horizontally and in the anterior of the mouth vertically. So when we take the posterior one, if you always remember that the elbow or the bend has to come out of the mouth, so we're going to do it for the upper right. We're going to place it in the 2 holes that are closest to the end of the holder, and then our ring has to be centered over the film, so it would look like this. If I wanted to change it for the upper right, I can then also do the lower left of my patient. So say we're finished with that, now I'm going to do the upper left. So I take the elbow still coming out of the mouth, take off the bite block, turn it a half a turn towards the ceiling now, take the ring off, and turn it up towards the ceiling so it's pointed toward the ceiling also. Now you're all set to do the upper left and the lower right. For the anterior view then, what we're going to do is we're going to hold the stem and the elbow with our right hand. We're going to place our bite block on and the last 2 holes. Take our centered ring and place it so that it encircles the holder, and now we have it set up for the maxillary and the mandibular. So this one you only have to know how to put it together one time. On the snap array, which we're going to use for the bisecting angle technique, it works like a scissors. And again, you can have them bite on either side of the holder, but for stability, the wider side is a good place for them to bite. If I'm doing the upper, I place the dot in the holder. Make sure that it's even here and flush, because whatever sticks out the bottom is taken away from the apices of the teeth. Lock it in there, and then I'm all set to do the posterior. When I get to the anterior, then I can just lock the scissors part of it. This is going to be my anterior holder. The dot goes in the slot, and that's the way the holder is for the anterior, so you only have one item to use. you.